Hey, hi everyone. Sorry, feeling a little bit under the weather right now, but thank you so much for coming to today's webinar, our survival guide to stop stroke and reduce high blood pressure in the Filipino American community. My name is Erica, and I'm part of the TAYO program under the Filipino Young Leaders Program. This webinar is coordinated by TAYO, a fellowship program within PhilPro. TAYO initially started in 2020 as a COVID-19 help desk providing medical information, but has grown into its own hub aimed at helping provide trustworthy and vital information to the Filipino community. This webinar will be focused on bringing awareness and educating our communities on high blood pressure and stroke within Filipino American communities. And just a quick disclaimer, the purposes of this webinar are purely educational and not intended to be personal medical advice, and we'll also be recording this presentation to share out, so feel free to opt out at this point if you're not comfortable being recorded or having your voice recorded in the presentation. So with that, me and my other editorial fellow will be moderating this presentation, and we put together this webinar under the guidance of Lizelle and Mark at Tayo and the editorial team, along with our partners at the Council of Young Filipinx Americans in Medicine. So my name is Erica Pernis. I'm a journalism and Asian American studies student at UT Austin, and I wanted to be involved in Tayo because I'm really passionate about community engagement and journalism and just wanted to learn more about the Filipino community and kind of the issues that they face and what they're going through. So yeah.
Right. And then, hi everyone. My name is Camelia. I graduated from UC Irvine last year in political science and English. Currently, I'm a freelance journalist, and I really wanted to join Tayo to just continue to get involved in the Filipino American community, and help create access to information. So, yeah, I hope you guys learned a lot today.
Hey, great. With that, let's hop right in with our expert speaker. So today joining us, we have a special guest, Dr. Antonia Moya, who will be talking about high blood pressure and stroke and how these conditions affect the Filipino community. And then following that, we also have a panel Q&A section with three speakers, which we will introduce later on in this program. So it's my pleasure to introduce our first guest, Dr. Antonio Moya. He is a board-certified neurologist and professor of neurology at the Keck School of Medicine of USC and Harbor UCLA Neurology. He is also the co-founder of the Council of Young Filipino Americans in Medicine and a leader in patient advocacy and professional development in the American Academy of Neurology. He also serves as president-elect for the Professional Staff Association of Rancho Los Amigos National Rehabilitation Center, and he currently focuses his work on stroke prevention as well as the health of the Filipino and Asian Pacific Islander community, serving on the board of the National Council of Asian Pacific Islander Physicians. He continues to partner with many Los Angeles-based Filipino community organizations, and his research and community work has been awarded multiple national and local grants. He is interested in stroke prevention and treatment, brain health, teleneurology care, and Asian Pacific Islander health disparities. Welcome, we're so happy you've joined us today. And with that, we'll transition over to his presentation, and I'll hand it off to him.
Thank you so much, everyone. Thank you for that kind introduction. Let me put my slides up here. One second. Here we are. And I will have to make some adjustments on the display. So let me know if it's actually showing. And there we go. Are you all able to see it or no?
No.
So I thought, okay, let me try to figure this out. One second. There you go.
Yes. We do see the full screen now.
All right, I'm just gonna make it the slides. So, oh, one second. Okay, now are you all able to see it?
No.
Share screen. You're only able to see presenter mode, right?
We can see the full screen.
Oh, good. Is it presenter mode, Lizelle, or is it actual?
It's like the PowerPoint. We see it like
Okay,
the actual
you see the
PowerPoint,
actual PowerPoint,
but we see everything though.
like the display. Sorry, we were trying to figure this
Yeah.
out before. So if I press duplicate slideshow, Lizelle, this is what happens.
Now we don't
So
see it. Yeah.
yeah, I know. You can see the notes too. Can you pull up the presentation, Camila, that I had emailed you all?
Yes, let me
We were
do that.
having technical difficulties. Sorry, everyone. Or maybe this will work. Let's see. Does that look better? There you go. I think I figured it out.
Yes, that looks
Okay, so
good.
you
Yeah,
all can see it
there.
now.
Yes, exactly. There you
Great.
go.
Thank you. Thank you. All right. So hello, everyone. My name is Dr. Moya, Antonio Moya. I am a neurologist working for LA County, and I teach the USC as well as the Harbor UCLA neurology residents and the USC medical students. Today, I'll be presenting on a survival guide to stop stroke and high blood pressure. I'm going to keep this pretty informal, so keep your questions till the end, but we can dive right into it. All right. So this is kind of the three R's that I want you all to remember when it comes to stroke. So I deal mostly with stroke patients, or I take care mostly of stroke patients. So we want to reduce stroke risk. That's the first R. Recognize stroke symptoms and respond immediately. So which is calling 911. And one of the things you'll hear me say over and over is emphasizing the need to call 911. All right. So just some of the statistics. Let me move this here. So stroke by the numbers, stroke is actually either the fourth or fifth leading cause of death in the United States. Okay. And the second leading cause of death in the Philippines. It is the number one leading cause of serious adult disability in the United States. And if you were to think about all the people who get stroke in the United States, each year it's about 800,000 people who suffer from new or recurrent stroke. So think of the whole city of San Francisco, the population of San Francisco. That is how many people get stroke each year. So more numbers so you all can kind of understand how serious of a disease this is. Every 40 seconds, a stroke has happened. So by this presentation, we've probably had three people in the United States who've had strokes. And every 3 to 4 minutes, unfortunately, somebody dies from a stroke. A very serious disease. About 167,000, in fact, die from stroke a year, and that was based on statistics from 2024. And this is the big thing that I want you all to take home. Up to 80% of all strokes are preventable through risk factor management. So you can see I have folks exercising here, Filipinos exercising. I believe there's a picture in Dubai or the Middle East, a Filipino group, and some examples of a healthy Filipino food like pinakbet, provided bagoong is lowered, and fruits and vegetables on the left. So are you gonna admit folks to the from the waiting room as well?
Yeah, we'll
Camila?
do that.
Good, great. Okay. So as you all know, Filipinos have had a very storied history here in the United States. We've been here since the 1500s, actually with establishment of our first communities in Louisiana and St. Malos. But more recently, we've had waves during World War II. My grandpa actually was part of that wave coming to the United States. We've served the United States well, and there's been a lot of integration with Filipinos, Filipinx Americans, and American culture. And now we have generations here of Filipino Americans living here. In fact, I'll show you some stats. We're the third largest group, Asian group, subgroup here in the United States. But again, with Westernization comes some of the unhealthy habits of American culture, including fried chicken. You all know about Jollibee, and we can talk more about the diet. Here are some statistics on Asian Americans in the United States. So there are six main origin groups that make up 81% of Asian Americans in the United States. Filipinos comprise 17% of the Asian American population here. That's based on data from 2021. In fact, one of my colleagues, we had looked at stroke in Asian Americans, and the reason why it's so important for us to talk about stroke is that Asian Americans have shown to have poor recovery from their stroke. They receive medications like tissue plasminogen activator, or also TNK these days, less frequently, and have more serious complications from these clot-busting drugs for stroke as compared to other ethnic subgroups. Women in stroke, women actually suffer a lot from stroke. A stroke kills about twice as many American women every year as compared to breast cancer. And more women tend to die from their stroke than men. And the risk is higher because of women's higher life expectancy. Women also suffer a greater disability after their stroke compared to men. Some famous people who've had stroke. You could look here on the left column. We have some Americans, and it doesn't matter who you are. You could be the president of the United States, suffer a stroke like President Gerald Ford. You could be somebody who's seemingly healthy, Jamie Foxx, Amelia Clark, a lot of folks who are actors. Luke Perry was more recently from 90210 who had died from his stroke. And even some Olympic athletes have had stroke. Michael Johnson, who is an Olympic gold medalist sprinter. There are other Filipino Americans also who've had stroke, included FPJ, Fernando Poe Jr. and his brother, and a host of other folks in the Filipino community who've had stroke have listed there. Now, what actually is a stroke? I get this. Actually, I had my stroke clinic this afternoon, and a lot of my patients still uh, don't understand yet that stroke actually involves the brain and not a disease of the heart itself. So the definition of a stroke, it's sudden brain damage. In fact, many people try to call a stroke a brain attack, just as we say a heart is a heart attack. A brain is a stroke is a brain attack. It can be caused by lack of blood flow to the brain caused by a clot in the blood vessels, either in the neck or inside the brain. And when you talk about different terms, the term ischemic stroke is correlated with or connected to a blood clot in the arteries going to the brain or a blood clot in the neck. It makes up a majority of the strokes in the United States, about 87%. And then the remainder, 13% in the United States, are what we call hemorrhagic strokes. Hemorrhagic meaning bleeding, bleeding around the brain, bleeding into the brain. So those are the two main types of strokes. But actually, research that I had done looking at data in the United States actually shows that Asian Americans tend to have more of the second type of stroke as compared to non-Asian Americans. So you can see here of that whole population, 24% of Asian Americans were having hemorrhagic stroke or the bleeding types of stroke versus 76% who had the ischemic stroke. The reason why this is so important is because the bleeding types of strokes are the types of strokes where people die more often as compared to ischemic strokes. Okay. So really bright yellow here, brain attack or stroke is an emergency. Stroke is an emergency. You need to call 911. What are the most common symptoms? Have you all heard of the acronym FAST, F-A-S-T? So any kind of sudden onset of facial weakness on one side of the face, oftentimes the lower side, drooping, any kind of weakness in a arm or leg. If that suddenly gets numb or weak, that could be a stroke. And then speech difficulty. If a person is having difficulty producing speech or understanding speech, that can be a stroke. So those are the things I want you all to remember. You have to think fast, F-A-S-T. T stands for time. It's time to call 911 because for every minute of your stroke, you lose about 1.7 million brain cells. That's why it's very important to call 911 if you suspect a stroke. Other symptoms here, sudden confusion, trouble seeing in both one or both of your eyes, trouble walking, sudden severe headache. So this is not just your general kind of like headache that generally ramps up. You have to think of a thunderclap headache, the worst headache that you've had in your life, 11 out of 10 pain. That can be a hemorrhagic stroke. All right. Now, if you all have heard of TIAs or transient ischemic attacks, they are temporary strokes. Okay, so TIAs are warning signs of future strokes. They happen in about 40% of TI patients will have a future stroke. So, what do I mean by uh, TIA? So, transient ischemic attack are similar to stroke in the sense that it's the same exact symptoms, but they resolve within minutes to an hours, up to even 24 hours. So if you see, for example, if I were having a TIA, I would have sudden onset of difficulty speaking, maybe a facial droop on one side, but then within an hour or two, it would self-resolve. That's called a TIA. That's still an emergency, and that person needs to be hospitalized. You need to call 911. I've seen patients where, it does happen. They don't they don't call 911. They stay at home because things got better, but then within the next 24 hours or 48 hours, they have another stroke, which causes them to be hospitalized. So let's go over some myths. So can stroke, here's one myth, stroke cannot be prevented. So I said before 80% of strokes can be prevented. There's no treatment for stroke. So many times people say like, bahala na, I already had a stroke, can't really treat it. That's actually not true. There's a lot of treatment that can be done within the first 4.5 hours to even 24 and 48 hours, so long as you call 911 and get brought to a hospital as soon as possible. Stroke only affects the elderly, as you had seen. That's not true. Michael Johnson, the Olympic athlete, had a stroke as well. It can happen to anyone at any time. And stroke does not involve the heart. That's a myth. Stroke involves the brain. Okay. Stroke recovery only happens within the first few months after stroke. Actually, that's not true. Stroke recovery is a lifelong process. In fact, we have different devices to help a person recover from stroke even years after they've had the stroke. Rehabilitation is very important. Strokes are rare. No, they're very, very common. In fact, it's now the fourth to fifth leading cause of death in the United States. Strokes are not hereditary. That's also a myth. Having a family history of stroke can increase your risk of having stroke as well. And if stroke symptoms go away, you don't have to see a doctor. That's false. That's called a transient ischemic attack. You need to see the doctor. In fact, call 911 and be admitted at the hospital as soon as possible. Here's just some data about the cost of stroke. Stroke is very costly, $56 billion annually in direct and indirect costs. And even just for the individual person, if you've had any family members who've had a stroke, you know how expensive it is to take care of that patient in the hospital, and not only that, after they're hospitalized. So here's the key slide that I want to emphasize for you all. What techniques do we have to reduce the occurrence of stroke, right? So starting with healthy diet over there, I'm going to move this over here. Um, Healthy diet, adherence to a DASH or Mediterranean diet. A DASH diet is a diet to reduce hypertension or high blood pressure. Having physical activity and exercise, about 150 minutes of or more of moderate or greater activity. Controlling your blood sugar, having a healthy diet, going on to here, making sure your LDL is less than 130, and we can discuss about the numbers for patients who've had a stroke. It's less than 70 milligrams per deciliter. Having blood pressure less than 120 over 80, and not smoking or vaping. Very, very important. Getting adequate sleep. So that also involves addressing things like sleep apnea, which can cause a heart attack and stroke. Okay. Um, Let me know also if I'm okay with time too. I know that there's a lot of information here. So, know your blood pressure. What I tell my patients who've had a stroke or at risk of having stroke, every time you brush your teeth, if you have a blood pressure machine, brushing your teeth, check your blood pressure. That's the morning. At nighttime, brush your teeth, check your blood pressure, and take a log of that blood pressure so you could bring it to your primary care doctor. Okay? Now, all you might know that the blood pressure guidelines have changed recently. So we are aiming for a goal of a systolic blood pressure of less than 120 and a diastolic blood pressure of less than 80. It's considered elevated. Blood pressure is considered elevated if it's above that at all. And you could see the different grades, right? We ideally, now we say that high blood pressure stage one is at 130 to 139, over 80 to 89. And then stage two is anything at 140 or 90 higher. Now, if this was a live audience and I asked you all, raise your hands if you had any family member with high blood pressure or have numbers higher than this, I would say probably 80% of you would be raising your hand, since high blood pressure affects about 1 out of 2 every Americans. So it's just a very common disease. What are some of the common things that we can do to reduce blood pressure? They're the things that we talk about in our clinic, but we really want our patients to take seriously with their family when they come home. Maintaining a healthy diet, the DASH style of eating, which is really emphasizing on fruits, vegetables, and whole grains, less red meats, less processed food. Sodium reduction, which is less than 2.3 grams or 2,300 milligrams per day, or even less than that. Increasing your dietary potassium, increasing your physical activity as well, making sure your stress is managed, and then reducing or eliminating alcohol. Um, Here again are the blood pressure numbers that we had talked about, and I'm just going to move forward just for sake of time. For any physicians or medical students here, I have this algorithm on how we treat blood pressure, but we can talk more about that during our discussion. Medication adherence. So this is something I want us to all discuss too. How many of you know somebody who's taking blood pressure medications but doesn't take it every day? You don't have to really raise your hands here, but just think about that. Oftentimes, I have many of my patients who say, well, I don't feel the effects of high blood pressure, so I stopped taking my blood pressure medications. Unfortunately, that is one of the ways that people have heart attacks and strokes. And it's very important that if your physician or nurse practitioner or PA is telling you to take your blood pressure medications, it's good to have that open form of communication showing that you're actually taking those medications. Atrial fibrillation, folks who have irregular heartbeats are at risk of also having stroke. So it's very important to know about that as well. If you smoke, stop smoking. If you vape, stop vaping, right? Vaping is not any safer than smoking. If you drink alcohol, do so in moderation. If you've never drank alcohol, don't even start. It's not many benefits from drinking alcohol. Know your cholesterol numbers, and we can talk more about that in detail. If it's high, work with your doctor to control it. And then if you're diabetic, follow your doctor's recommendations carefully. Okay? Exercise, low sodium diet for our Filipino community, reducing fried foods, chicharron, crispy pata, all the stuff that you kind of get in fiestas. Just be very careful of the food that you're eating, right? Increase your vegetables, pinakbet, tinola, monggo. All of these types of food can be healthy, provided that ingredients like patis that are high in sodium are reduced as well. And then if you have any circulation problems, talk to your doctor as well. Okay. Again, 911 if you believe you're having a stroke. I've seen so many patients who said, I'm going to get my family to drive me to the hospital. And we'll talk more about that. But try to call 911 immediately if you suspect stroke. So here are some of the research that I've done before related to the Filipino community. This whole concept of bahala na, right? Leave it to God. In some translations, keep calm and bahala na si Batman. Uh, you know, we can talk more about this as a community, but in terms of stroke, heart attack, it's very important to call 911 immediately. All right, so here are some of the things that I've heard from my Filipino patients. Denial, I'm not having a stroke. Nakakatakot, I'm scared to call 911. There's nothing to be done, bahala na. Maybe there needs to be a reframing on how we think about these things. I don't want to be a burden worrying about the cost of not calling 911 or thinking that the symptoms will go away is something that some Filipino patients who've had stroke have expressed to me during clinic. Okay. Fear of going to the hospitals, ayokong magpa-hospital, some of the common themes that I've seen. There is treatment for stroke. That's the reason why it's so important to call 911. There's medication to actually dissolve the blood clot when it's inside your brain, if that's what's happening, okay? Um, Tenecteplase TNK is a standard medication that's given within 4.5 hours. Some countries use TPA still, and there are surgeries to remove the blood clot within a certain period of time. If you have bleeding in the brain, there are ways to clip aneurysms or do coiling to aneurysms, get neurosurgical intervention that can only be done in the hospital. Okay. I've worked at UCLA and other hospitals, for example. Um, the time is so important that they're actually putting CT scanners inside the ambulances, right? So that they can scan your brain to see if you have any bleeding, and then if you don't have that kind of thing happening, you could potentially administer some of these medications that reverse the stroke within the field in the ambulance. Okay. Some of the information regarding recovery, 10% of stroke survivors can recover completely. That's why it's so important to talk about rehabilitation. And then 25% will have minor impairments, 40% will experience moderate to severe impairments, and unfortunately, 10% will require either going to a skilled care facility or long-term care facility. 15% will die shortly after their strokes. Okay. I work at a rehab hospital. It's so important to work with a physical therapist, an occupational therapist, as well as a speech therapist to help you get back to hopefully where you were before your stroke after you've had a stroke. Recreational therapy is also very important, returning to your activities of daily living to get better after your stroke. And I'm going to kind of go over here. After you have a stroke, oftentimes you get rehabilitation services within the stroke unit. Okay. And if you're able to do 3 hours or more of acute rehab therapy every single day, most likely you will be brought to an acute rehabilitation unit, which is what we have at the hospital that I'm working at. After that, you could do home with outpatient therapy. A lot of my patients will go to the hospitals to get their PT, OT, speech therapy. And then for our patients who are really disabled after their stroke, at times they will be brought over to subacute rehabilitation where they're at a long-term facility, if their family is or friends are not able to take care of them at home. There's always a lot of community-based programs to improve after your stroke. And if you want more information on stroke or prevention of stroke, the website there is stroke.org. I really suggest you all have the chance to check that out. It's from the American Stroke Association, American Heart Association. Really, the goal in learning all of this information is not to memorize every single number here, but to know that stroke is an emergency and that you need to call 911. There are so many things that we as Filipino Americans in our community can do to prevent stroke. Um, Remembering the signs and symptoms of stroke, and ideally we want to, grow healthy into our old age. We want the same for our family members as well. All right. Thank you very much. I'm very happy to answer any questions you have, and we have a wonderful panel right after this as well. Thank you.
Thank you so much, Dr. Moya, for sharing all of your insights. I certainly learned a lot from this presentation. I hope you all did too. We will have a bit of a Q&A right now. We're going to transition into that, and we'll also open it up to the audience later. So you can add your questions in the chat now, or later on we'll have that opportunity. So before we begin, I'm very excited to introduce each of our speakers. Each of them have been caregivers for family members with these conditions. We have Carl Aragones, Van Dexter Kahlo, and Lizelle Tanglao. And Dr. Moya, feel free to jump in with any insights along the way as well. I'm going to quickly introduce each of them. So Carl is a Filipino American student creative based in Los Angeles. He's the co-founder of Lumea, which is a youth-led media platform. He's also explored public health and healthcare through clinical community and youth advocacy. Van Dexter Kahlo is a fourth-year medical student at the University of Arizona. He's originally from rural Mindanao in the Philippines, and he's committed to improving health outcomes among the Filipino community. He's also a leader with the Asian Pacific American Medical Student Association and a co-founder of Hepatitis B Free Arizona. And then we have Lizelle. She is a bridge journalist at the intersection of editorial, product, business development, and community. She is the head of audience and membership at the LA Local, and she is also the immediate past president president of the Filipino Young Leaders Program, PhilPro, and a project director of PhilPro's Tayo. So now onto the actual panel. First, could you all just maybe tell us a little bit about yourselves personally, and what does participating in this discussion mean for you as caregivers for family members who have had these conditions?
Oh, yeah. Thank you. And thank you for having me. I think the biggest context for why I'm here is that for about 4 years, I helped care for my grandmother following her stroke. I started pretty young, 13 to be exact. And something I've realized looking back is that I never really thought of myself as just a caregiver, right? I thought of myself as just her grandson. Helping her was just something that became part of everyday life and part of what our family did. That's why participating in this conversation is so meaningful to me. Dr. Moya has given us the medical perspective on what these conditions look like, but I think that there's another question of what happens when the patient goes home and a family begins reorganizing itself around what someone needs post-stroke. And especially as a young Filipino American, caregiving has made me think so much more deeply about ideas like familial responsibility, bayanihan, and utang na loob, and also about how we make sure that people providing that care are supported themselves.
Yeah, I can go next. Hi everyone. Thank you, Dr. Moya, for that really needed review. I took notes while you were presenting there, so that was amazing. But yeah, this conversation is definitely meaningful because I'm coming in with two perspectives. As mentioned, I'm training to become a physician, but before that journey, like Carl, I've been a family member taking care of my Lola, kind of seeing how chronic diseases just affects an entire family. In medical school, we get taught about, the clinical perspective of high blood pressure and stroke, but being on the other side taught me what the diagnosis actually mean when you're in a home setting. It's that worry that you carry, the navigating like the appointments, medications, and just trying to, understand what comes next. So I think having both sides really shaped to the kind of physician I hope to become. Not one that not only treats the patients in front of me, but also recognizes, the family members and caregivers that was standing beside them the entire time.
I can go next. Hey everyone, I'm Lizelle. Yeah, for me personally, this particular topic hits home. Navigating new territory. Dr. Moya mentioned it in his presentation. My mom recently experienced a TIA a few months ago around Memorial Day, and just trying to figure out how to navigate that whole situation and kind of just figuring out, how to respond to cultural like fears and nuances about like calling 911, what to do, and also like how to better advocate for not only ourselves but our family members when we are asking these questions and getting clarification on things that we don't understand and what we can do. So really happy that we are talking about these difficult conversations because I think I'm seeing a lot more of our friends, family members, peer group kind of going through similar things and just knowing that we're not alone and having some tips, actually something that's actionable is really.
Thank you all for sharing. It was great hearing a little bit of your stories. If we can move on to the next slide. We have a few questions prepared, so going to get a little deeper now. Can you talk a little bit about your experience as a caregiver? What was that process like, and how does it affect your Filipino identity?
I can take it. I think caregiving made my Filipino identity much more tangible to me. What I mean by that is that growing up it's easy to understand culture through things like food, language, celebrations or traditions, but caregiving truly showed me that culture also shapes how we understand our responsibility towards other people. After my grandmother's stroke, helping care for her was never really presented to me as some sort of extraordinary act, right? She was my grandmother. Of course, we're going to take care of her. And I think there's something deeply Filipino in that assumption. One concept I've connected to that experience is the concept of bayanihan. We usually think of bayanihan as a community coming together to carry something that would be difficult for one to carry alone. The visual of people carrying like a bahay kubo above their heads, for example. To me, that's almost a perfect metaphor for caregiving. When one person becomes vulnerable, everyone around them has to adjust and help carry that weight. I also like to think about the concept of utang na loob, which can be a double-edged sword. I hesitate to translate it simply as debt because I think it's more nuanced and richer than that. There's a sense of reciprocity to it where someone cared for you and helped raise you or contributed to who you actually became. And when they became vulnerable, there's this deep feeling that you show up for them as well. I think that those values are beautiful, but caregiving also provided me the ability to recognize the tension between them. When caring for family is understood as something you just do, the actual labor behind caregiving is almost invisible, right? Someone can be exhausted or overwhelmed and still tell themselves, this is my family, I'm supposed to do this. It's an enormous burden. So I've started thinking that maybe the healthiest interpretation of Bayanihan in this context isn't necessarily celebrating one person for carrying an enormous burden. It's making sure that burden is shared between a familial community. And I think that's how caregiving affected my Filipino identity the most. Culture became less of an abstract to me. I could actually see it tangibly in the way my family responded when one of us became vulnerable, in all the responsibility we felt towards one another, and in the ways we learned to carry the responsibility of caregiving together.
Yeah, I could kind of add on to that. Yeah, I totally understand the whole perspective about, being in this family-oriented like culture. We don't really we don't give ourselves the title of being a caregiver. It's more of just being a family member. And that could really kind of just shape how you view this role as more of like an obligation, but it's also a responsibility as well. So it's a troubling sometimes perspective to sit with. So I was caring for my grandmother when I was around high school. So I knew at that age I knew a little bit about how to manage just like the day-to-day things like taking their blood pressure, and obviously this experience definitely shaped the my path to medicine. But I think with the whole concept of like, the utang na loob, the having to give back or to the sacrifices they made for us, especially as immigrants as well. It's definitely meaningful to do so, but it sometimes puts you in a situation where it's kind of difficult to, I think, admit when being a caregiver can be overwhelming or you actually need support yourself. And so I feel like you obviously want to give back and you want to be there for whoever you're taking care of, but I feel like sometimes the attention kind of shifts away from you as a caregiver, and that can also lead to more, I feel like, more consequences than help, because as we say, if we're not taking care of ourselves, how do we expect to do the same for others? And so yeah, I think that battle in your head being Filipino and then also fulfilling your role in the family community. But it can be troubling sometimes, and it shouldn't be ignored, especially when you're given that role, even though it might not seem like it.
Yeah, plus one to everything that's already been said. What I would add to that is it's funny because in many ways, I don't necessarily view myself as a caregiver per se, but in many ways, I think that is kind of the roles we play whenever one of our family members experiences something like this. I think it's even more prevalent, especially if you come from a smaller family. I think about it also just kind of the clash of cultures in many ways, because in the Philippines, you're often surrounded by many family, not only blood family, but extended family. But when you're out here, and especially if you already come from a smaller family, I mean, I'm an only child, there are less people to kind of you know help out with in many ways. And this is where I think it's like, how do you navigate kind of these different like situations now, where it's so different from if, say, you were back in the motherland versus here, and just kind of getting over and figuring out how to ask for help beyond your immediate circle, because you can't do that alone. And that's also very a Filipino thing as well. So it's just kind of, being open to those possibilities, and also figuring out how to navigate kind of these new situations, especially if you don't have a big enough kind of group of people that are already there.
Thank you
Okay.
all. It's great to hear how you've all, how it's shaped your Filipino identity. And yeah, I think we'll move on to the next slide.
Yeah, so that was so interesting to hear, especially like kind of from like the family oriented culture kind of view. Like you don't really like consider yourself a caregiver, you're kind of just a family member at that point. And kind of like I thought what Lise also said was interesting because like my family's like they're each the or my parents are each the only people from their families to come to the US. So there's less of that like support community. And my parents like both had high blood pressure, so when I was growing up, I thought it was so normal for them to just be like checking me and my siblings' blood pressure like really frequently every day. So that's interesting to hear about as well. So kind of moving on to question two, do you think there are any misconceptions about high blood pressure or stroke in these conversations or taking care of someone with these conditions, and kind of like what have you learned from all of it?
I'll talk about some of the misconceptions about high blood pressure, and this is not just my Filipino patients. Um, they call high blood pressure a silent killer, and the fact that one out of two, so let's say even just statistically, there's about 20 of us here, 10 of us may statistically have high blood pressure. It's pretty shocking how common high blood pressure is. And another question I'd pose to you all is like, when was the last time you all got a chance to check your own blood pressure? And I'm guilty of this too. Right in clinic, I was like, oh, I better check my blood pressure right before this talk because I actually haven't checked it in a while. So it is a silent killer. And oftentimes it's a bit too late. A person will have high blood pressure for years before they actually have symptoms of it, like a stroke or a heart attack or headaches or anything like that. So it's important to, if your titas or titos are saying to you, oh, I feel fine, like I don't need to take any medications. Ask tito or tita or your mom and dad or lola, like, oh, Lola, when was the last time you checked your blood pressure? And that kind of opens up the discussion.
From the caregiving side, I think one misconception I'd like to challenge is what we imagine a caregiver looks like. Before this experience, I definitely would have pictured a caregiver as an adult, maybe a professional, a parent, a nurse, or someone like formally responsible for another person's medical needs. I didn't necessarily imagine someone younger, and definitely not my 13-year-old self. But I've learned that caregiving exists on a broad spectrum. Not every act of helping a family member necessarily makes someone a caregiver, but care doesn't also have to be a full-time or clinical job in order to make meaningful responsibility. Sometimes it's just helping someone through the routine, keeping them company, paying attention to what they need, and adjusting your own schedule around them, and simply just becoming one of the people they consistently depend on. For me, though, that distinction was quite difficult to recognize at first because I never really thought, oh, I'm caregiving. Instead, I thought I'm her grandson, right? This is what I'm supposed to do. And I think that's a interesting cultural nuance in Filipino families. There's a strong expectation that caring for family, especially elders, is simply part of being part of the family dynamic. It's a double-edged sword. I don't necessarily see that as negative, but definitely that sense of responsibility and interdependence can be a real strength at times. But I do think that there's a tension there. Um, when care is purely understood as like an obligation of love or family, the labor involved becomes almost invisible, especially to the person doing it. That's why I think that recognizing someone as a caregiver isn't necessarily about putting a label on every family relationship, and it isn't about making care transactional either. I'm not saying like I did this for my grandmother, so deserve recognition in return. It's more so about having a language for responsibility that can affect someone emotionally, socially, and practically. Because if we only recognize caregiving when it looks formal, when someone is managing the medications, providing physical care, or has caregiver as an official role, we can miss a lot of the things that people carry quietly in terms of that responsibility. And if we don't see them, it becomes much harder to ask another question that I think is equally important. Who is caring for the caregiver?
Yeah, that's an interesting point too as well. Like I mentioned, like the caregiver role should also be recognized. So I'm glad you highlighted that as well. Um, Kind of on a personal note, like with the when I remember taking care of my grandmother, and I remember the doctor, told us to like, cut the sodium and just like, oh, that food's not healthy. And this, physician wasn't from a Filipino background. And so when you have no doctors in your family and no one yet in medicine, you're just you just have to follow the orders, right? You're just like, okay, so we're gonna get rid of XYZ. And I slowly, throughout time, you start like I noticed that some of our foods at home started to look less Filipino, which is very sad to say. And when you really think about it, obviously like we think about cultural foods, like the party foods, sure, like yeah, they're definitely not on the healthier sides, but honestly, Filipino food has this really bad rep of being called unhealthy, which I completely disagree with. And I think obviously having a different lens now that I got more knowledge about nutrition and things like that, this it's a big misconception in our community that our food is not advertised as healthy when most of our foods are cooked at home. They're cooked with very fresh ingredients, lots of vegetables. Like we think of tinola, like the use of mongo or mung bean. Those have been shown to have medicinal properties to really help with our diet and also, have benefit us in terms of our health. So that misconception was very misleading in my opinion. And, it shows the that, what physicians tell patients could really have an impact on how we approach our own health. And it also brought to the point of just the importance of diversity in medicine, which is what I'm learning now, and how we need to push that agenda of, that cultural foods should be tailored to what fits the patient's need. And there's always going to be adjustments that could be made without losing the culture in our patients. And so that's something on that end that I've learned.
Thank you all so much. It's great to hear this dialogue about caregivers also needing to take care of their own mental health in that process, and Van talking about the cuisine. I think about that a lot, how there's kind of this assumption that Filipino food is unhealthy, but there's a lot of nutritionally dense food there. So let's move on to the next question. We can change the slide. So this is our last question for this portion, and then we'll open it up to the audience. What advice do y'all have for folks who are just starting their caregiving process or who have been caregivers themselves?
Mhm. I think the first thing that I'd say, especially to another young person, is that you don't have to know everything immediately. Ask questions, communicate with your family, and when something is medical, ask the professionals involved, rather than feel like you're supposed to figure out everything yourself. But the bigger thing I'd say is that don't confuse loving somebody with having to carry everything alone. That's where I come back to the concept of bayanihan. Sometimes we celebrate the person who's willing to sacrifice everything for their family, but I don't think that's necessarily the healthiest version of caregiving. If bayanihan means collectively carrying something that's too heavy for one person, then what should we actually practice, or how should we practice that within caregiving. Who else can help? What responsibilities can be shared? And who is checking on the caregiver? And I think there's sometimes yeah or shame around admitting that you're struggling. You can think that, oh, this is my parent or this is my grandparent. Why do I have to complain? But those aren't mutually exclusive things. They can coexist. You can love somebody and be tired. You can feel a sense of utang na loob and still need support. And you can willingly take responsibility and still acknowledge that the responsibility is difficult. I think my advice would be to let people help you help for someone. Caring for yourself isn't stepping away from your responsibility to your family. It actually makes the care much more sustainable. Yeah.
Yeah, I think I totally agree with that. You don't have to have all the answers in the world and you don't have to do everything alone. I think it's a big takeaway. And as a caregiver, like you are the one of the sole advocates for the one you're taking care of. And the healthcare system isn't the most, it's not always going to be on our side. And so we have to find a way to navigate through that. And if it's finding the right physician that is from the similar background, or can, it takes us time to kind of listen to your concerns, or it's you really have to take the initiative to care for someone when sometimes you might feel like the system is against you. Healthcare is difficult. Insurance like is difficult. We as in the healthcare industry, we also find it difficult to advocate for our own patients in that regard. So but you're not alone in doing so, and always reaching out for help is not a sign of weakness. And it's definitely easier said than done, but it's really important that taking care of yourself, it's just part of this whole process.
Yeah, the only thing I would add to that is don't be afraid to ask questions. Ask for clarification if anything doesn't you don't understand, because that can only help you better advocate for your loved one and also yourself if you are on this journey, and that you're not alone.
Thank you all so much for all your responses to our questions. This was such a great conversation about just the the hidden ways that caregiving, the role that caregiving plays. So thank you. We're gonna go into some audience questions. So I do see a few in the chat, which Dr. Moya, I'm hoping you can address those. If anyone has any more questions, feel free to put it in the chat. You can also raise your hand if you feel comfortable. Cynthia says, I'm 74 years old and my blood pressure ranges from 140 to 150 over 70. I take my blood pressure in the evening before I sleep. Am I a candidate for a stroke? Dr. Moya.
Thank you so much, Ms. Argona, for that question. And you know, let me just first say that I'm not anyone's personal physician here, and any medical advice I talk about, you should talk about your primary care physician. Just by having an older age of 74 years old and having blood pressure ranging in that area, you can be considered at higher risk of having a stroke. It's really an important conversation to have with your primary care doctor to see if you should likely be on blood pressure medications. Oftentimes in stroke, we call it the unholy triad, right? Of high blood pressure, high cholesterol, diabetes, right? But there's so much more than that. Smoking, activity, et cetera, et cetera. So I would talk to your primary care physician to make sure that you get checked for that, and that you're getting your blood pressure. Ideally, below 120 over 80 is the goal, but it's circumstantial. It depends on each person.
Thank you for that. And then Susan says in the chat, Dr. Moya, at what age should young Filipinos start eating healthy, especially when cardiovascular disease runs in their family? I heard that fat deposits happen over time.
Yeah, thank you so much, Ms. Maggio, for that question. Um, as soon as possible. So it's very interesting. I show my patients pictures of their brain after they've had strokes, and there's certain images that show the damage that's accumulated over many years. Sometimes they'll ask me, "Well, when did, the small pieces of damage happen in my brain?" And I tell them, "Well, it's actually happened over years, maybe even decades." So the sooner you could start eating a healthy diet, the better that you work to reverse your risk of having stroke. And as I had said before in the presentation, 80% of strokes are preventable. If you could talk about the things that are most important, which is high blood pressure, high cholesterol, diabetes. Um, the diet is so important, right? I think that common saying is let food be your medicine, and as well as making sure that you have an active lifestyle.
All right. If no one has any questions, I do have a question, maybe to our caregivers or also to Dr. Moya. If anyone has any particular resources or support or just things that y'all went to for guidance throughout the caregiving process or just to learn more about these conditions, feel free to discuss those, or even if there's links, you can drop it in the chat. But yeah.
There's a lot of resources out there about stroke. You know, a lot of websites have been actually looking for healthy Filipino recipes as well. Be sure to show these websites also to your physician, to your dietitian, because there's just a lot of things out there. People will say a certain supplement will reverse your risk of stroke, and a lot of that might not be backed up by scientific evidence. So just always have open discussions if you can with your nurses, with your physicians, with your pharmacists. Don't have HIA if that's at all possible, right? It's okay to talk about these things. And I think as if we as a community talk more openly about our own health struggles, challenges, or triumphs, I think overall that makes our community healthier. So thank you so much, Tayo Help and CFAM as well, Council of Young Filipino Americans in Medicine, for allowing me the opportunity to share this information. And I hope that this all gets recorded as well so that it could be brought out to those who were not able to attend today's session.
Yes, thank you so much to our panelists. Thank you to Dr. Moya. I feel like throughout this process, we've really learned so much about the conditions and the caregiving side, but also just opening up this dialogue, having these conversations, which is so important. Of course, like any information that you encounter moving forward, there's a lot of mis and disinformation out there, so always check it with your physician, of course, and do your research. So thank you all again for joining and engaging with the webinar. We're going to move forward. We have another slide. All right. If you could share any feedback you have, this is like part 3 of some of health webinars that Tayo has been doing. So you can feel free to scan that QR code, or it'll be under bit.ly/Tayo blood pressure feedback. I will put that in the chat. And yes, if you can just take a few minutes, it's all anonymous. We'll also be sending out the recording and the feedback form too. And then I think Erica, if you want to add on, and then you can go to the next slide.
Okay, final thank you again to everyone for joining us today. Before we fully wrap up, are we gonna do the Tayo plug also?
Oh, it's okay.
Oh, okay,
Yeah, we're
sorry.
already up to time. Like, yeah, it's fine. But thank
Okay.
you.
Yes. Okay. So thank you again, everyone, for just joining us to the webinar. And just a reminder that we'll be sending out the recording shortly if you want to push it out to any more of your networks who think would find this information helpful. We don't want to hold you guys too long over time. So have a nice night, everyone. Thank you. Thank you for joining us.